So this dude right here is Benjamin Rush, and Benjamin Rush was an 18th century doctor who's coined as the father of American psychiatry. And Benjamin Rush, among other awful things, coined the term negritude, which was a disorder that he described as Black people having a rare form of leprosy that made their skin turn black, and that the cure would make them white. And one of his boys, Dr. Samuel Cartwright, was just as awful. And he coined this term, drapetomania, which is also known as runaway slave syndrome, that he described as a mental illness that Black people had that caused them to want to flee slavery. And this awful dude also coined the term dysesthesia aethiopica, which he described as a mental illness that caused Black people to be lazy and intentionally create mischief. Psychiatry was founded and rooted in racism, and it continues to echo in our practices today. We have to work very hard to create justice and equity. Meet Emil Kraepelin, who was a German psychiatrist and another one of the founding fathers of psychiatry. And Kraepelin is known for discovering what we now know as schizophrenia, which he initially called dementia praecox, which translates to an early dementia. However, this dude was problematic AF. He believed in social Darwinism and psychiatric eugenics, believing that white people were a superior race and that slavery was justified due to natural selection. This dude also believed in degeneration theory, which suggested that white people got more mentally ill when people of color and people who weren't like him were around. He was also part of the Nazi Party, and there were assertions saying that he contributed to the killing of his own patients. The diagnosis of schizophrenia is fraught with racism and stigma. Changing his legacy begins with education. The term schizophrenia was initially coined by Eugen Bleuler, a Swiss psychiatrist, in 1908. And up until the 1960s, schizophrenia was diagnosed in lower middle-class white women when they were classified as ill if they didn't perform their wife or motherly duties, and they were often defined as calm and easy-natured. In the 1960s, with the rise of the civil rights movement, Black men were diagnosed with schizophrenia at an alarming rate. They were put into psychiatric institutions, which at that time were pretty much prisons, citing that their involvement with the civil rights movement and identification with Black power was delusional. Clinical charting at these institutions claimed that these men were psychotic, aggressive, and dangerous to society. It also cited that they were paranoid because they were worried about being killed by police. The second edition of the DSM, which guides our psychiatric diagnoses, also came out during this time in 1968. And it used terms like hostile and aggressive to classify the diagnosis of schizophrenia, which was overused in Black men. The overdiagnosis of schizophrenia in Black men remains today, as Black men are 2 to 4 times more likely than their white counterparts to be diagnosed with schizophrenia.